Are you looking for a comprehensive resource on tiotropium? In this ultimate guide, we will unlock the benefits of this powerful medication, helping you make informed decisions about your health. Tiotropium is a widely prescribed medication that has proven effective in treating respiratory conditions such as asthma and chronic obstructive pulmonary disease, COPD. With its unique mechanism of action, tiotropium offers long-lasting relief from the symptoms associated with these conditions, allowing individuals to lead more active and fulfilling lives. In this guide, we will delve into the science behind tiotropium, exploring how it works, its potential side effects, and the best practices for using this medication. Additionally, we will address some frequently asked questions to provide you with a thorough understanding of tiotropium. So, whether you are a healthcare professional seeking deeper knowledge or someone dealing with a respiratory condition, this guide is for you. Join us as we explore the benefits and efficacy of tiotropium, backed by scientific evidence and expert insights. Understanding COPD and asthma. Chronic obstructive pulmonary disease, COPD, and asthma are two respiratory conditions that can significantly impact an individual's quality of life. COPD is a progressive lung disease characterized by chronic bronchitis and emphysema, leading to airflow obstruction and difficulty breathing. Asthma, on the other hand, is a chronic inflammatory condition of the airways that causes recurring episodes of wheezing, coughing, and shortness of breath. Both COPD and asthma can be triggered by various factors, including environmental allergens, respiratory infections, and tobacco smoke. These conditions can severely limit a person's ability to engage in physical activities and can even be life-threatening in severe cases. How tiotropium works to treat COPD and asthma. Tiotropium belongs to a class of medications known as long-acting anticholinergics. It works by blocking the action of acetylcholine, a neurotransmitter responsible for bronchoconstriction and mucus production in the airways. By inhibiting the effects of acetylcholine, tiotropium helps relax the smooth muscles surrounding the airways, allowing for improved airflow and reduced symptoms of respiratory conditions. Tiotropium is available in inhalation powder form, commonly administered through a handheld inhaler device. The medication is designed to provide long-lasting relief, with effects lasting up to 24 hours. This makes it an ideal choice for individuals who require sustained symptom control. Benefits of tiotropium for COPD patients. Tiotropium has been extensively studied for its efficacy in managing COPD symptoms. Clinical trials have consistently shown that tiotropium improves lung function, reduces exacerbations, and enhances exercise tolerance in COPD patients. By improving airflow and reducing inflammation in the airways, tiotropium helps individuals breathe more easily and experience fewer respiratory symptoms. Moreover, tiotropium has been shown to improve quality of life in COPD patients. It allows individuals to participate in daily activities without the constant fear of breathlessness and provides a sense of control over their condition. This improved quality of life can have a significant positive impact on mental well-being and overall satisfaction. Benefits of tiotropium for asthma patients. While tiotropium is primarily indicated for COPD, recent studies have also explored its potential benefits for asthma patients. Asthma is a complex condition with various subtypes, and not all patients respond to the same treatments. For individuals with severe or difficult to control asthma, tiotropium may be considered as an add-on therapy to existing treatments. Multiple studies have demonstrated that adding tiotropium to standard asthma therapy can lead to improved lung function, reduced symptoms, and decreased exacerbations. It has been particularly effective in patients with asthma that is not well controlled with inhaled corticosteroids alone. Tiotropium's long-lasting effects provide sustained relief and can help individuals achieve better asthma control. Dosage and administration of tiotropium. The recommended dosage of tiotropium may vary depending on the individual's condition and the specific inhaler device used. It is important to follow the instructions provided by the healthcare professional or read the patient information leaflet carefully. Tiotropium inhalation powder is typically administered once daily, at the same time each day, for optimal symptom control. The inhaler device should be primed before the first use and should be cleaned regularly to ensure proper functioning. It is important to inhale the medication deeply into the lungs to achieve the desired effects. If a dose is missed, it should be taken as soon as remembered. However, if it is close to the next scheduled dose, the missed dose should be skipped. Double dosing should be avoided. Potential side effects of tiotropium. Like any medication, tiotropium may cause side effects in some individuals. The most common side effects include dry mouth, constipation, urinary retention, and sore throat. These side effects are generally mild and resolve with continued use. However, if they persist or worsen, it is important to consult a healthcare professional. In rare cases, tiotropium may cause more serious side effects such as allergic reactions, increased heart rate, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. Precautions and contraindications for using tiotropium. Tiotropium should be used with caution in individuals with certain medical conditions, such as narrow-angle glaucoma, urinary retention, or an enlarged prostate. It is important to inform the healthcare professional about any pre-existing medical conditions or medications being taken before starting tiotropium. Additionally, tiotropium is not recommended for use in pregnant or breastfeeding women unless the potential benefits outweigh the risks. It is always advisable to discuss the use of tiotropium with a healthcare professional to ensure its safety and effectiveness for individual circumstances. Tiotropium FAQs. Is tiotropium a rescue inhaler? No, tiotropium is not a rescue inhaler. It is a long-acting bronchodilator medication used for maintenance treatment of respiratory conditions such as COPD and, in some cases, asthma. Can tiotropium be used alone or in combination with other medications? Tiotropium can be used alone for the management of COPD. In asthma, it is usually used as an add-on therapy to other asthma medications, such as inhaled corticosteroids. How long does it take for tiotropium to start working? The onset of action for tiotropium can vary among individuals. Some may start experiencing relief within a few days, while others may take several weeks. It is important to be patient and consistent with the medication to achieve optimal results. Can tiotropium be used in children? Tiotropium is not generally recommended for use in children under the age of 6 years. However, it may be prescribed by a healthcare professional in certain cases for older children. Are there any drug interactions with tiotropium? Tiotropium is generally well tolerated and has a low potential for drug interactions. However, it is important to inform the healthcare professional about all medications being taken to ensure their compatibility with tiotropium. Conclusion: the power of tiotropium in managing COPD and asthma. Tiotropium is a powerful medication that offers significant benefits in the treatment of respiratory conditions such as COPD and asthma. Its unique mechanism of action provides long-lasting relief from symptoms, allowing individuals to lead more active and fulfilling lives. Whether you are a healthcare professional seeking deeper knowledge or someone dealing with a respiratory condition, understanding tiotropium's benefits and best practices is essential. With its proven efficacy and safety profile, tiotropium is a valuable tool in the management of COPD and asthma. By unlocking the potential of tiotropium, individuals can take control of their respiratory health and improve their overall well-being. Thanks for watching.